Dr. Boileau, if you can tell us in English, we're looking at the INES figures, the projections from today. It would appear that there is going to be a dip. In other words, looks like we've hit the peak of the sixth wave, but Easter hasn't been factored in yet. Can you tell us, have we hit the sixth wave, the peak of the sixth wave, and what impact will Easter have?
Well, I know the methodology of Ines quite well. I was the CEO and president of this organization until recently, 3 months ago. And we had this discussion with the CEO of Ines this morning and the expert, Dr. Mike Benigeri. And as you may have heard before, Ines those projections are mathematical ones and made very carefully with a lot of methodology that will figure if it continues that way, then it will be that in 2 weeks. But continues that way, it's still something that we're not sure about because we only have two data from this week. During the weekends, it was very low, and it should not be a bias or confusion measures that will figure that this lowering will still be there. So with few more days, we'll be more confident on that. But there is a strong hope that we'll get there. And normally Ines is not missing the call, and which is fortunate is that, as Dr. Opaterny said, there is about 2,400, maybe we'll reach 2,005 in a few days, but it should not get really more than that. And on the intensive care unit, it's still around or less than 100 beds, which is great right now. And Dr. Patani said earlier that only 5% of the cases are moving to the intensive care unit, which is really different from the other waves and which is great for the health system because it's really challenging everywhere in the hospital, but especially in the intensive care unit.